Parasomnia is a term for unusual behaviors that people experience prior to falling asleep, while asleep, or during the arousal period between sleep and wakefulness. These behaviors vary considerably in terms of characteristics, severity, and frequency, but include sleepwalking, sleep paralysis, and night terrors. Non-rapid eye movement sleep arousal disorders are parasomnias that involve repeated episodes of incomplete awakening from sleep, most commonly sleepwalking or night terrors, but occasionally more complex behaviors. These episodes usually happen during the first of the night, and people have no memory of the episodes in the morning. The first diagnostic criteria required for this disorder are: first, it is the repeated occurrence of incomplete arousals usually beginning during the first third of the major sleep episode that typically are brief, lasting 1 to 10 minutes, but may be protracted, lasting up to 1 hour. The eyes are typically open during these events. It is also accompanied by either one of the following. Number 1 is sleepwalking. It is the repeated episodes of rising from bed during sleep and walking about. While sleepwalking, the individual has a blank, staring face, is relatively unresponsive to the efforts of others to communicate with him, and can be awakened only with great difficulty. Sleepwalking is also called somnambulism. This parasomnia typically occurs during the first few hours while a person is in the deep stages of sleep. The DSM-5 criteria for sleepwalking require that the person leave the bed, although less active episodes can involve small motor behaviors, such as sitting up in bed and picking at the blanket or gesturing. Because sleepwalking occurs during the deepest stages of sleep, waking someone during an episode is difficult. If the person is awakened, she typically will not remember what has happened. It is not true, however, that waking a sleepwalker is somehow dangerous. Number 2 are sleep terrors. It is the recurrent episodes of abrupt terror arousals from sleep, usually beginning with a panicky scream. There is intense fear and signs of autonomic arousal, such as mydriasis, tachycardia, rapid breathing, and sweating during each episode. There is relative unresponsiveness to efforts of others to comfort the individual during the episodes. Sleep terrors, also called night terrors or pavor nocturnus, are the abrupt terror arousals from sleep, usually beginning with a panicky scream. It most commonly afflicts children. On the surface, sleep terrors appear to resemble nightmares. The child cries and appears frightened, but they occur during NREM sleep and therefore are not caused by frightening dreams. During sleep terrors, children cannot be easily awakened and comforted as they can during a nightmare. Children do not remember sleep terrors despite their often dramatic effect on the observer. Second of the diagnostic criteria is no or little dream imagery is recalled. During episodes, the individual has reduced alertness and responsiveness, a blank stare, and relative unresponsiveness to communication with others or efforts by others to awaken the individual. If awakened during the episode or the following morning, the individual has limited recall for the episode. After the episode, there may initially be a brief period of confusion or difficulty orienting, followed by full recovery of cognitive function and appropriate behavior. Third, we have amnesia for the episodes is present. At the end of each episode, the person may wake up or return to bed and go to sleep. They will not normally have any memory of it in the morning or may have patchy memory. If woken while sleepwalking, the person may feel confused and not remember what happened. Other criteria includes the following. First, the episodes cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Second, the disturbance is not attributable to the physiological effects of a substance. Third, coexisting mental disorders and medical conditions do not explain the episodes of sleepwalking or sleep terrors. Sleepwalking episodes can include a wide variety of behaviors. The individual may simply sit up in bed, look about, or pick at the blanket or sheet. The individual may actually leave the bed and walk into closets, out of the room, and even out of buildings. Individuals may use the bathroom, eat, talk, or engage in more complex behaviors. Running and frantic attempts to escape some apparent threat can also occur. However, cases of unlocking doors and even operating machinery, driving an automobile have been reported. Sleepwalking can also include inappropriate behavior, like commonly urinating in a closet or waste basket. There are two specialized forms of sleepwalking. First, sleep-related eating behavior. Individuals with sleep-related eating experience unwanted recurrent episodes of eating with varying degrees of amnesia, ranging from no awareness to full awareness, without the ability to avoid or stop eating. During these episodes, inappropriate foods or even non-food items may be ingested. Second is sexomania. Varying degrees of sexual activity like masturbation, fondling, groping, sexual intercourse occur as complex behavior arising from sleep without conscious awareness. This condition is more common in males and may result in serious interpersonal relationship problems or medical legal consequences. Violent or sexual activity during sleepwalking episodes is more likely to occur in adults. Eating during sleepwalking episodes is more commonly seen in women. Sleepwalking occurs more often in girls during childhood, but more often in men during adulthood. Among children, sleep terrors are more common in boys than in girls. For the diagnosis of NREM sleep arousal disorder to be made, the individual or household members must experience clinically significant distress or impairment. Embarrassment concerning the episodes can impair social relationships. Social isolation or occupational difficulties can result. For individuals with sleep-related eating behaviors, unknowingly preparing or eating food during the sleep period may create problems such as poor diabetes control, weight gain, injury, or consequences of eating dangerous or toxic inedibles. Rapid eye movement sleep behavior disorder may be difficult to distinguish from non-rapid eye movement sleep arousal disorders. In contrast to non-rapid eye movement sleep arousal disorders, rapid eye movement sleep behavior disorders occurs during rapid eye movement sleep. Individuals with rapid eye movement sleep behavior disorder may be awakened easily during an episode and report more detailed and vivid dream content than do individuals with non-rapid eye movement sleep arousal disorders. These individuals and/or their bed partners often report that they act out the dreams.